Hi there, my name's David McPherson. I'm a CPD advisor and work for NHS Education in Scotland. I'm based in the west of Scotland, and today I've been asked to go over the new GDC guidance on enhanced CPD. The aims of today is to introduce you to the new GDC guidance on enhanced CPD, and I'll explain, or you'll see later on, why the aims are important. These are the specified learning outcomes to discuss the GDC changes to CPD introduced from 2018, to demonstrate the components of a PDP, methods of identifying your learning needs in your field of practice, and how to complete your annual statement to the GDC. When you go to the GDC website and you look for enhanced CPD, this is the page you'll see. So you'll all get very familiar with this page. Once you click on there, you'll see there's a video, and this is a short watch, and you can update your information and skills from here. But you'll see at the bottom of the page there that this 1st of January 2018 is the starting date for dentists, and the 1st of August 2018 for dental care professionals. So we'll go over the main changes, and I've arrowed here the first two that I'll discuss. So the requirements for all dental professionals to have a personal development plan, and at the bottom there, the requirement for professionals to plan CPD activity according to their individual fields of practice. So this is a new expression that the GDC are now using, fields of practice. So on the GDC website, you'll see that they've got some templates. And this is an example of the first couple of templates that we need to use with the new enhanced CPD. So at the top of the page there, you'll see my field of practice. So this is a template you'd use really just to identify if your field of practice is general or whether it's more specific, or whether you have certain areas of clinical practice that you don't need to engage in CPD because it's not your remit, or you may have advanced skills. You may do something like myself where you work for NES and you may need to have skills in doing PowerPoint or whatever. So if you look along the top, you'd fill in your name and details, your work setting, any additional roles. So for example, I would put I work for NES, and then you'd also think about your actual patient population. So if you specialised and you worked in orthodontics, obviously that would be very relevant to targeting your CPD going forward. The lower template is your personal development plan. This is just the GDC's example template. You don't have to use it, but as they've put this together, it would seem prudent that a lot of people start off using the GDC template that they've given us. So you'll see along the top line, what do I need to learn or retain from this cycle? So that's where you'd start to populate things that you've identified as you needing to do CPD in, and we'll talk about that a little bit later. How does this relate to my field of practice? So again, having used the template above, you will have identified what your field of practice is. Do you have any specific areas, whether it's teaching, whether it's some speciality that you really need to focus on? Which development outcomes does this link to? Again, new terminology. And I'll come to that a little bit later in this presentation because, again, this is a completely new concept. What benefits will this have to my work? So you're really having to think about, if you're doing CPD, how's that going to benefit your practice, your patients, your team, everything like that. Next, how will I meet this learning or maintenance need? So you'd be thinking about what kind of CPD would you access? Would it be e-learning like this? Would it be going to a lecture? Would it be going to a conference? Would it be going online and Googling something, looking at YouTube, whatever that might be? So there's many ways you can actually access that CPD. Of course, some will be verified and some will just be learning, and you'd have to differentiate that. And then finally, we've got when will I complete the activity? It's very important that we timeline things. And we predict ahead what kind of time scale that we expect to meet our learning needs that we've identified in the first column. So, PDPs may be new to some of you, to others they've probably done it before, but a personal development plan is for your own personal use. It's your PDP. It's to carefully consider your role and what CPD will give maximum benefit to maintain and develop this. The GDC may ask to see your PDP. This is unusual, it's certainly be rare, but they may ask to see it. And that would to check whether the minimum requirements are being met in terms of the planning, time scaling, etc. And as I've already mentioned, there are other PDP templates you can use. There's a lot online. However, personally, I don't really see any particular reason to stray from the GDC one that they've already given us to use. So we mentioned minimum requirements. What are they? Well, the GDC are asking us that the CPD we plan to undertake is relevant to our field of practice. So we've already identified our field of practice. We've already identified if there's any additional training we need to do. But of course, it may well be that there may be CPD that we don't need to do anymore because we're no longer involved in that field of practice. Say, for example, radiology. If you're no longer taking x-rays in your clinical practice, then you'd no longer have that in your field of practice, therefore you wouldn't need to do that. You'd need to also have the anticipated development outcome, so they'd certainly be looking for that information, and as we've already mentioned, the expected time frame for each. It should be regularly reviewed. A personal development plan is not something that you do and you have to stick to rigidly. It's adaptable, it's fluid, it will roll from year to year. It should be a yearly cycle, but you would want to allow it to be adaptable if something happened in the interim. If, for example, you saw a really good course and you identified as actually that would be beneficial to my practice, my patients, my own training needs. It may well be there's new legislation made, for example. And for example, like this, the GDC have obviously made these changes and you'll probably be watching this because you have a learning need because you're unaware of what the requirements of enhanced CPD is. So sometimes you may change the time scale, you may prioritize one thing over another. So it is an adaptable, fluid thing, but it's good to stick to some sort of framework if you can, even though it's adaptable. It should be, as I say, regularly reviewed. So, learning needs is a very difficult thing for most people to identify. There's been a lot of studies showing that clinicians are not very good at this. We tend to gravitate to things we like. So if you like endo, you tend to put yourself in endo courses. What we're trying to do is really find out what you need rather than what you want. And there's a few ways we can do that. The following questions, as you see on this slide, they can be prompts just to try and identify what our learning needs might be. So if we just go through them in order, they may identify our strengths and weaknesses in our practice. So the first one, which areas are we most proud of or that we feel reflect our practice and your skills? Which areas do you find most difficult or frustrating? What have your achievements been? Where do you have any concerns? What do you need to change in your practice? What were the outcomes of any audits that have been carried out in your practice? These certainly may flag up further audits or further training. What feedback have you had from colleagues and patients? So it may be positive, it may be negative. It may well be that you've watched a colleague and you see that they're got skills that you don't have. They may have gone on a training course and bring back that information to you. And finally, are you up to date with core compulsory or core recommended topics? We'll talk about that a little bit later in some more detail. So what we're trying to do is identify areas of weakness in our practice and address these as learning needs. You may also think about patient complaints, turning a complaint into a positive, into identifying that learning need. Our practice inspections will certainly identify learning needs on a 3-year cycle. And of course, regulatory change, as I've already mentioned, like, for example, the CPD changes that we're talking about today. There are no compulsory CPD topics. There are only recommended topics. and we'll spend a couple of minutes just talking about that. The GDC recommends that most clinicians have the following. So medical emergencies, they really expect all registrants to do 10 hours in a cycle and at least 2 hours annually. So in our 5-year cycle, we really want to be covering 10 hours. Disinfection and decontamination, they would like us to do 5 hours in our cycle. And finally, radiography and radiation protection, again, 5 hours in our cycle. But the caveat being that, as I've already mentioned, if you do not take x-rays in your field of practice, then that's not something you would have to do CPD in. So really that change is really making our learning needs more tailored to our needs and our patient needs. Other recommendations are legal and ethical issues, complaint handling, oral cancer, mainly the early detection of, safeguarding children and young people, and safeguarding vulnerable adults. All these topics really contribute to patient safety, and that's why the GDC has recommended that list of subjects as being highly recommended. So certainly in the last 2 slides, those are subjects that we would start to populate our PDP with really from the start of each cycle. So going back to the main changes, we'll now look at another 2. So an increase in the number of verifiable hours for most professional titles and the requirements to spread the hours more evenly across the 5-year cycle. Previously, we could do all our hours in the first year and then do nothing for 4 years, or of course the opposite, do all the hours at the end as a mad panic trying to tick a box. The other thing, as you'll see in the next line, is dental professionals no longer have to declare non-verifiable CPD to the GDC. It's not suggesting we won't do it, it's just that we no longer have to declare that. So in effect, in summary of those 2 things, the only thing we're talking about going forward is verifiable CPD. And because there's only that, really the verifiable word is being dropped, and the GDC will just talk about CPD, but what they're really meaning is verifiable CPD. This slide's from the GDC website as well, and you'll see just where I've arrowed it, that you must do CPD regularly and at least 10 hours every 2 years. And just to the left of that, in the top row, you'll see that dentists in the top there have to do 100 hours minimum in their 5-year cycle. Dental therapists, dental hygienists, orthodontic therapists, clinical dental technicians are having to do 75 minimum hours in their cycle. And then you can see in the last 2, dental nurses and dental technicians having to do 50 hours in their cycle. So what makes it verifiable? And this is what I was mentioning right at the beginning of the presentation, are the aims and objectives. So if we don't have aims and objectives, it's not verifiable, so they need to be there. Now, one of the changes is that we need to identify the anticipated GDC development outcomes. And as I've said already, we'll mention that a little bit later on. You have to identify the date that the training or the CPD was undertaken, which may sound obvious, but obviously if you're learning something over a period of time, you really have to identify each chunk of that learning and when it took place. The total number of hours have to be indicated, who participated, including your GDC registration number, so that would obviously be noted. And written feedback to the body, quality assuring the education. So the education is provided by many different providers. At present, CPD-A is awarded by NES. NES do not provide the education, the CPD, the verification. That is done by the provider themselves. So, just recapping, we have to do at least 10 hours every 2 years, so that's an additional change. So basically, we can take a year out, but only a year. So that allows for somebody, for example, to be on maternity leave and really being able to take a year away from thinking about things. However, once you go into that second year, you really are having to complete at least 10 hours. Okay, other main changes. The requirement to align your CPD activity with specific development outcomes. This is 2 or 3 times we've now mentioned these development outcomes, and this is a new thing altogether. And again, on this slide from the GDC website, as you'll see on the right of the slide, each CPD activity must have at least one of the GDC's development outcomes aligned to it. So these are the development outcomes that the GDC have indicated. And as you'll see, they're indicated on the left of the slide as A, B, C, and D. So just to summarize, A would be effective communication, B would be effective management, C would be your knowledge and skills, so more your clinical-based CPD, and finally D would be maintaining patient confidence in the profession, so our behaviours, our attitudes, that kind of thing. On the right-hand side, you'll see examples of CPD content, and you'll see there's a whole range of different things there. So each CPD provider will have to link their CPD with these development outcomes, and it may be more than one. So if you think about today, you're listening to me talking about this, so which development outcome is this? So just have a think about that for a moment. These are obviously regulatory changes. These affect our behaviour going forward. And a lot of the changes that the GDC have made are really to ensure patient confidence in the profession, ensure that we're keeping our learning up to date and we're being upskilled. So I've indicated there that I imagine the majority of you will agree that it's really maintaining patient confidence. Now, NES has come up with the following icons, and you'll see these on a lot of CPD certificates going forward, and you'll see just running from left to right, A, B, C, D, in the domains that we've already talked about. So today would be maintaining patient confidence, but there'd also be a little bit of effective management, as obviously your CPD and keeping your logs and your records fall under that category as well. So I would say that today's a little bit of both. So there's other good news, and you'll see here, this is again from the GDC website, that clinical audit is now seen as being a verifiable CPD. So we can now align our verified audit hours to be part of our CPD cycle. So we're all doing audit in some fashion or other, and we can now align that on our PDPs as being part of our CPD. And so we would apply the same mentality of identifying what kind of things we would audit from our learning needs, just as we did with our CPD, and we'd fill that into our professional development plans exactly as we've done with CPD already. So, nothing to do with the GDC changes, but in Scotland there has been changes to audit from October 2017. And you'll see in the top line there that quality improvement projects is now the overarching title of audit. So you'll see this QI projects tab quite a lot going forward from 2017. So we'll still call it audit, but it's all now under the umbrella of quality improvement. So different forms of audit are individual audit, where you'll just look at something yourself as a practitioner. You might do practice or team audits, where you'll look at something as a team. You may get involved in large facilitated audits. There are audit committees. There are national audits, so you can get involved with them. Enhanced significant event analysis, where you'll look at things that have gone really well in your practice, or look at things that were near misses or accidents or errors. Peer review, I think, will probably take a larger importance going forward as well. And then finally, you've got practice-based research, which you'll see adverts, over in the dental press over the months going forward of different kind of research projects that you may be able to take part in. They'll tend to be regionally based, so it may well be that Due to your geography, you won't be able to take part in something, but if there's something happening in your area, then obviously that's an area you could get involved in. So, quality improvement, an audit, how do we get started? Two best places to look would be the NES dental audit documentation being on the NES portal. So you click on the NES portal and really you just follow the process. The iBooklet section on the portal is now labelled as quality improvement, not dental audit, so some people are finding it hard to find, but if you click on that, it basically takes you through in a template where you'll identify what your audit's going to be on, and you just fill it in from there, and there's some examples and some information in how to do that properly. So, going back to the GDC slide again, you'll see this time I've arrowed the word reflection. And one of the things the GDC are asking us to do in terms of recording our CPD and keeping our CPD records is that we should include an element of reflection. Now, a lot of younger clinicians have trained and gone through university with a far more reflective practice. And I'm one of the older dentists that really hasn't come across reflection in my training, and it's something that I've had to sort of learn about as I've gone along. So just to help people like myself, things we might ask ourselves in terms of helping us reflect on a course on CPD would be the following. What did you learn? Was it helpful to your work or to the treatment of your patients? Did you identify any changes needed to your daily work? How did you make these changes? If no changes, what did the activity confirm to you? So did it confirm that how you were doing your root treatments was the most up-to-date way of doing it? That the way you were processing your X-rays was now still the gold standard? And finally, what was the benefit to your work or to your patients from going to that CPD? So if you ask yourself those questions, having been to any of the CPD that you've identified, that will help you create some sort of reflection. And then it's a question of recording that. Now, the GDC have helped us again by creating a template for this, and you'll see that this is called the activity log template. And again, if we just follow along the top line, it's asking us to date it, indicate the hours completed, give the evidence, so most times that will be a certificate, title of the provider, and the sort of content of the CPT activity. We're being asked again to indicate the development outcomes. We've already talked about the A, B, C, and D. And then finally, how did this activity benefit my daily work? And you'll see just below that in the small writing is exactly those questions that I've just gone through with you. So that would be the sort of thing, once you've been to your CPD, you would fill in this template, and it would help you just create a sort of reflective log. Okay, so further changes. We're now asked to make an annual statement, as you see, as I've indicated that at the bottom of this page. So what's different about the CPD statements now than before? Well, as before, we have to self-declare, and we go to the GDC website for that, and there'll be a template, the same as there is previously, and we fill it in. The things that will ask us will be how many hours we've done, so required annually. So we have to do this even if we have done no hours. So at the moment, if you do no hours, you wouldn't be required to fill that in, you would just leave it blank. Now they're asking if you've done no hours to actually indicate 0 hours. You're asked to declare the number of hours that you've completed, declare that you have recorded your CPD activity, and declare its relevance to your field of practice. So you're really just self-declaring all of these areas. This is just a slide showing how a NES CPD certificate will now look going into 2018. You'll see that it still has the aims and objectives, sort of just from the middle of the form down. But below that, you'll see now we have development outcomes indicated, and the A, B, C, and D for effective communication, effective management, knowledge and skills, and maintaining patient confidence are now indicated, and you would delete as appropriate so that you're actually highlighting the development outcomes that specific CPD was actually targeting. Finally, just looking at this slide again from the GDC website, it really summarizes everything I've talked to you about in this presentation. If you look at the planning phase, we'll think about our field of practice, identify our learning needs, link this to the GDC development outcomes, and we'll design our PDP from there. Once we've done that, we'll complete our CPD activity, collect evidence from each activity, meet the hours that we're required to do, and adjust our PDP as we need to throughout the cycle. As I said, it's a fluid thing. Once we've done that, we have to get to the reflective stage. We will review our activity, reflect on the impact on our daily practice and our patients. We'll make a record of our reflection and our reflective log, and we'll adjust our PDP as needed, mark that it's complete. And then finally, in the recording part, ensure your evidence matches the verifiable CPD you're declaring each year. So just tally up the hours and check that your PDP shows that. Complete your annual statement online. And finally, complete your end of cycle statement. So that would be at the end of the 5 years, a further declaration. This is the website for the GDC, and specifically taking us into the enhanced CPD section. But if you just Google GDC, you should be able to find it quite easily. Thank you very much for listening. I can be contacted at NES if anybody has any further inquiries. Thanks for listening. Thank you.